Hey guys, Cassie Deputy here with Deputy Tribe. I just got out of sauna. That's why I look like crap. But I'm driving home from sauna and I just wanted to kind of give a quick update while I have some time alone because I'm going to be home in a few minutes with the kids. So recently we have been treating the Lyme disease as well. So I have 12 infections that we're fighting. So we're treating the 12 infections, and then I just got my mold panel back today, and I don't exactly understand the results yet. I'm meeting with my doctor next Wednesday to go over those, but there was positives for mold toxicity. I think there were between 3 and 5 different types of mold that I tested positive for. But we started really intense treatment last Thursday. So twice a week I go in and I get high dose vitamin C. So I'm getting 75 grams twice a week. So that's 75,000 milligrams intravenously twice a week. And then I'm doing hyperbaric oxygen an hour twice a week. And then at home on the days that I'm not doing that, like today, because I did it yesterday and I'm doing it tomorrow, I do sauna. I do infrared sauna for about a half an hour, and then I take Epsom salt or bentonite clay baths, and then I have like this clay thing that I drink that, so the sauna is supposed to help. It's infrared, so I guess it goes real deep into your body and it pulls a lot of the mold and the toxins out, and then the binding stuff that I drink is supposed to pull it out and neutralize it, or the bath that I take. Today I'm not taking a bath though. So, and then I'm taking a lot of different supplements. I'm on, I think, 3 different natural antibiotics. So one's a big black pill that's filled with all sorts of really gross oils that I burp up when I eat it. Oregano oil, I don't know what kind of oils. And then the other one is actually one that I was on 3 months ago to kill the bacteria in my stomach. It's got cat's claw, wormwood, tons of that. So I actually take twice the recommended dose, twice a day. And then some other one that I'm on, I don't remember. And then I'm doing like PEMF mats, I'm breathing in hydrogen, I'm doing a lot of vagus nerve stuff still, a lot of just trying to kind of regain mental capacity. So it's been going pretty good. I had my second round of hyperbaric and vitamin C yesterday, and I'd have to say I feel pretty good today. My stomach is killing me and my skin gets real hot. But as far as energy goes, I feel like I maybe have more energy. My lymph nodes are definitely not as swollen as they usually are. They're almost always swollen. So that's good. Yeah, I've been sleeping fine. I'm still on a ketogenic diet. I actually hired a nutritionalist from the Charlie Foundation, and they specialize in the ketogenic diet for epilepsy. So she has a diet prescription that she typed up for me, and does all the math to make sure that I stay in the range that I want to be in. And then I just check my ketones every day, and then my blood ketones twice a week. And we've been driving them up pretty high, which I'm happy about, because the higher my ketones are, the better I can tell my cognitive skills are, and I haven't had any epilepsy or anything. The one thing I have noticed is after my IV treatments, I start kind of losing control of the left side of my body. So my face, I'll start twitching, like my eye or my lip will just start twitching. And then yesterday, my whole right arm was just shaking. I couldn't get it to stop. And then my tremors came back and got pretty bad. So what I'm thinking is I may drink ketones the days that I have IV, because I'm thinking it's maybe diluting the amount of ketones in my blood. I don't think it's kicking me out of ketosis, but I think it's lowering the ketones to the point where maybe my nervous system is misfiring, or my brain's misfiring. I had a little scary moment yesterday. I was at women's Bible study after therapy, and I played piano and sang. My tremors were bad, but I kind of got them under control. But then during the study, this left arm was just shaking, and I could not get it to stop shaking. So I was just praying. I was like, Lord, do I take like an anti-seizure med? Like, is this a focal seizure, or is this just my nervous system kind of being shot? So it took probably a good half an hour before it would stop shaking. I mean, it was obvious. It was like shaking. So I'm not sure what that's about, but I'm thinking it has to do with the high-dose vitamin C and the dilution of ketones in my bloodstream. So it's going to get real bumpy here because of the ice. Oh, dear goodness gracious. Okay, don't get stuck. Oh, the water is kind of evaporating. So that's kind of where I'm at. I could use as much prayer as you can remember to pray for me. Gas is ridiculously expensive driving to all this stuff, but it's gonna really help, and I think it's really gonna be the thing to finally get better. So I think I've been, if yesterday wasn't a seizure, then I've been seizure free for 5 weeks, which is huge, without medication or anything. And then I started natural antibiotics Thursday. I gotta mark this on my calendar. So I think I'm on the antibiotics and all these treatments for 3 months, and then we're gonna kind of assess where I'm at, and then potentially continue another 3 months. So we were praying about whether to go to an actual center and get just checked into a center for a month and just receive real intense treatments, or try to pursue treatments here locally so that I could still be home a lot. And finance-wise, it would be probably cheaper to just go to a center because of the amount we're spending in gas driving to therapies. But I talked with my doctor, and we were going to give it a 2-week trial, which ends next week. And as I was kind of pursuing the different places to receive treatment from, I found a hyperbaric oxygen place in Minnetonka, which is where I go to my neurologist, and I have my therapy there. So I had therapy, and then I got in my car and I punched in the address. Well, he's in the same building. He's on the 1st floor of the building, and my therapy's on the 4th floor. So I was like, wow. So I go in, the guy's a believer. We sat there and talked about the Lord the whole time. Like, he was on the phone while I'm in the chamber because I was kind of nervous, and he was kind of talking me off the ledge, you know. But as he's talking, the Lord was like, this guy's here to minister to you. And I was like, oh my gosh. And it's true. Every time he talks, I'm just like, wow, what he says just hits home and really challenges me in my perception of things and my walk with the Lord. So I absolutely look forward to just listening to him. So then after my hyperbaric oxygen, I was telling him how I do high-dose vitamin C at a different place. And I love the people there, but I just don't like the facility. There's just a few things that I'm like, it just doesn't feel homey, right? I hate going there. I don't get excited to go there except for talking to people. So he's like, there's one in this building. And I remembered my neurologist told me there was one in this building. And I was like, oh. So I went up there, and right before they closed, I talked to them, and they do all the treatments that I would want. So they do the high-dose vitamin C. They do the ozone, which I'm doing hyperbaric right now, so I don't really want to pair the two. I think that's too much oxygen. But yeah, so I established myself as a patient there and started there yesterday. And the nurse is a believer. I went and I talked to some of the people that are sitting with me, and the guy that was sitting next to me was a believer. He does Bible studies in his home. He's got pretty bad throat cancer. But I just love going to those and talking to people. So as I was driving home, and that morning on my way to all these therapies, the Lord was like, this is my grace on you. And this is your natural chemotherapy and your natural radiation, the vitamin C and the oxygen chamber, and your natural antibiotics. Like, this is my grace on you. And I was really humbled by that going through the day. And then on my way home, the Lord was like, this is where you're supposed to be. Like, this is it. This is the plan. These are the facilities. This is the treatment. This is it. This is it. I had complete peace about it. So I just go down to one building, and everything's all in the one facility, and it's really nice. The IV place may be moving locations, I think, but they're literally just down the street. So I'm not driving to different cities and doing all this crazy stuff. So tomorrow I have treatment all day, and Alex and the kids are going to be coming with me. I have a short day, so I just have IV and hyperbaric, and then we have church after that. So yeah, so they're going to come with me tomorrow and see what it looks like. And then next week I have a very long week of lots of therapies. So you can be praying for me. I have next Wednesday, I have my neurology clinic. I meet with my lead doctor, Christy. She's the one heading everything up. And then I do high-dose vitamin C, and then I do hyperbaric all on Wednesday. So it's going to be a whole ordeal of a day. Yeah. So thank you guys for praying for me. Thanks for all your support. I'm really excited and hopeful for where we're heading. I think we're on a really good track with the diet and the supplements and the treatments. And I'm only on treatment 2, and I already feel a difference. I was told that I'm going to feel much, much worse before I feel better. And that is true, because I've been throwing up a ton, and my stomach is not happy with everything that's going on, and my skin gets rashes. So the other night I woke up in the middle of the night just to vomit like crazy. And last Thursday after treatment, I started vomiting. So I know that the numbness, the tremors, the vomiting will probably get worse before it gets better, because we're pulling all that stuff out of my body. But I'm really excited for the Lyme diagnosis, because I've been sick for a long time, probably since I was little, and they never could figure out what was wrong. And I've noticed, like, every time I kind of like would get sick, it'd be worse and worse. And there was one time I was pregnant with Evelyn, my 7th, and I had what they thought was a stroke. I all of a sudden had my left side go numb. I mean, it was really intense. I couldn't walk or talk for 6 weeks. I couldn't, I literally could not think about what I wanted to say and form words. It was really humiliating. And they never figured out what it was. They did countless MRIs. They tried different medications, and nothing worked. And Lyme disease makes sense. I also used to have heart problems, and they would have me wear a monitor, and they'd track irregularities in my heart, blood pressure regulation problems. Again, they wanted to try meds. And again, nothing worked. But now understanding Lyme disease and how it kind of travels through your body, like, I've had knee problems and hip problems and foot problems, and like just weird things that I know I'm not making up in my head, that just kind of come and go. Like, it's one thing after the next. I had a really bad allergy to corn that led to anaphylaxis constantly. Like, it just attacked different systems of my body. And now it's attacking my brain and my nervous system. So the running theory is, when I hit my head and had the concussion, all the Lyme and stuff flooded into my brain and is causing the epilepsy and all of the other issues. But on a good note, guys, I started driving again. So I'm driving myself, and that's been really good. I will say the Lyme has also spread into my eyes. So my vision is very poor. I see floating specks everywhere, and they really block my vision. And then I have like this cloud kind of over my eyes, so everything's foggy and blurry. And that's a bit scary. Like, I often have to talk myself off the ledge, like, you're gonna be okay, you're gonna be okay, don't freak out. But I see floaty specks everywhere. My doctor said that that's very common with Lyme, and that will get better too. So yeah, so that's kind of the update, and I'm home now, so I'm gonna go spend time with my kids. Bye, guys. And don't forget, Jesus is coming.